At first, you think it's just a rash. Then your muscles start to ache. Your head hurts, your throat is on fire, your joints are sore, your back aches, and you break into a fever. You shiver, and you are exhausted. Then the rash becomes something else entirely. What began as a flat sore develops into blisters filled with a liquid that is white, it is itchy and painful, and when the skin breaks, it oozes pus. Then those blisters become lesions, hundreds of them all over the body and in awkward places too, from the palms of your hands to the soles of your feet, on your face, in your mouth, your throat, your groin and genital areas, even in the anus. And if you're lucky, the rash heals. The lesions dry up, crust over, and fall off. And if you are not lucky, you die. 16 cases of Mpox have been confirmed by the National Department of Health, and now the South African Border Management Authority says it's implementing screening processes for travelers entering the country at all ports of entry. Murdock Ramathuba is the Assistant Commissioner for Specialized Services at the Border Management Authority and joins us now. Thank you so much for your time this morning and welcome to 702 Breakfast.
Thank you very much, and good morning to you and your listeners.
So what exactly are you going to be doing at the points of entry?
I think the first thing we should have done was to take you and put you at OR Tambo and say exactly what you were saying just before you asked me this question. You would seem to understand this disease very, very well. But anyway, what we're doing, we are strengthening our screening processes in the ports. You will recall that we do have thermal scanners in our ports of entry that assist in identifying people with elevated temperatures. That is where the fever issue comes. And if we are isolating them so that we can have further observation on and interviews in terms of the checking whether the travel history as well as the symptoms that you have been mentioning just earlier. And if we find any of those, we then start to suspect that you could be having Mpox. That's when, through the arrangements that we have with the various emergency services, that is the provincial ambulance services as well as the private ones, we evacuate you to the nearest health facilities, which we already have prior arrangements with those so that they can manage you further when you are in those facilities.
Look, it's the middle of winter and therefore flu season. I was down with this nasty one last week, for example, and might easily have failed your test at an airport. So how will you know that an elevated temperature is Mpox related and not something else?
That is where the non-invasive observation that is done by the port health officials or the nurses in the port, depending on which port you are at, comes in. Because when you are isolated because of elevated temperatures, the interviews will guide those that are engaging with you towards a particular direction. Because you are right, there are many other diseases that may be associated with elevated temperature, but it may not be Mpox. So that interview and that observation that is done by the port health officials employed by the Border Management Authority in all our ports assist in addressing that gap.
I guess my point is there are so many symptoms that come with this thing and not just an elevated temperature. If you remember the description I gave of it as we started this conversation, this is firstly something that I would imagine must be uncomfortable and unlike, say, COVID, would not be desirable or even easy to hide.
It is true. Like you said, if you are coming, you've got flu, I have Mpox. After we were assessed and our temperatures were elevated, other symptoms that we look for, like you spoke about blisters, you will not have blisters because of flu. I will be having those. Then that eliminate you from the suspicion line. And then we go further symptoms by symptom, and then we can then say we refer you, because some of the questions that are asked also refers to whether you have been in contact or in proximity with a person that might be having Mpox before.
Aren't you, in a sense, bolting the stable long after the horse has jolted? I mean, this thing is already here.
You see what we do as the Border Management Authority, which I believe you already know. Ours is to prevent the importation of diseases. We have the disease in the country. As you have said, we've got 16 cases and 3 deaths already. That's what the National Department of Health and the provincial departments of health are dealing with in the country. Ours is to prevent further importation or importation of diseases that may worsen the case that we have and to burden the health system that is already burdened in the country.
Have any of the reported cases been linked to travel outside the country?
No, not as far as I know, as we know. The reports that we get from the Department of Health, cases seems to be local. We haven't gotten anybody through who has come through our port of entry whatsoever.
One of the things people will necessarily raise is that we know that our border controls are notoriously poor. Not everyone who enters South Africa tells you they have.
Can you repeat the question?
I'm saying our border management is notoriously poor. Not everyone who's in the country has told you they've come.
Yeah, but that is true. You might be aware as well that we've got over 4,441 borderline in the country. If a person is to walk through from any of our neighboring countries through any of the areas where at the time of walking through the soldiers who are mending the borders are not there and our border guards are not there, that person may enter the country and we may not know that the person has entered. But those that comes through the formal port of entry, we are monitoring those, whether it's through the airports, through the land crossing, also through the harbors. We've got systems that are in place to control that. So what you are raising as a challenge, it's one of the things that the Border Management Authority it's mandated to deal with going forward, and we are in the process of increasing the stakes on that. You can see with the successes that we are recording on a monthly basis.
This thing is spread mainly through contact with infected persons or contaminated surfaces or objects. If it's as bad as your measures suggest, how concerned are you about the risk to BMA workers and your officials?
The risk of spread of communicable diseases affect literally everybody. It's everybody. It can be impacted by that. But one thing that you will know is that unlike with COVID, you don't have direct contact with travelers except their traveling documents. Hence, you find that we promote the use of sanitizers in our ports for our officials. Who will be handling this, the people that are coming into the country, amongst other things.
Appreciate your time. Murdock Ramathuba, the Assistant Commissioner for Specialized Services at the Border Management Authority.
Current events, developing stories,
tough questions,
your voice making a difference.
This is Breakfast with Bongani Bingwa.